Hello, ladies and gentlemen. Hope you're all well. I'm Abdurrahman here. Just want to share some information that I came across that I thought, hey, every parent, every person that has someone that they love, that they care for, that might have any type of disease, might want to know if this is something that they should know about. Okay, I was at a conference event about 2 weeks ago, and one of the speakers spoke about pandas. This was something I've never heard of in my life before, and I thought to myself, oh my god, a lot of people need to know about this. So as I'm doing my research, I just thought, what, let me actually record about 5-minute video educating people about what this is and how they can educate themselves better. Okay, now I never knew what pandas is. Pandas is short for pediatric autoimmune neuropsychiatric disorder associated with streptococcus infection. Does that make sense? So that's what it stands for. Okay, PANDAS, pediatric autoimmune neuropsychiatric disorder associated with streptococcus infections. Now, here's what the internet is saying, and literally all my research is based on the internet. Okay. Now, here's what I'm finding out. A child may be diagnosed with PANDAS when they have OCD, obsessive compulsive disorder, okay, tick disorder, or both suddenly appear following a streptococcus or strep infection, when they have a kind of throat infection or a scarlet fever. Okay, so that's what the first thing is about PANDAS. Okay, now some people might wonder, what are the symptoms of PANDAS? Here's what the symptoms of PANDAS disease are. Okay, the symptoms of PANDAS include obsessive thoughts, compulsive behavior, and motor or vocal tics. These symptoms can be accompanied by a variety of other neuropsychiatric symptoms such as separation, anxiety, moodiness, irritability, and sudden anxiety attacks. Okay, now some people might wonder, and this is one of the things I wanted to find out, is this curable? If a child has PANDAS, is this curable? And here's what you can find in the internet. Okay, when treated in a timely fashion, PANDAS or PANS, okay, by the way, it's a variety of it as well, appear to be stopped and potentially cured with prompt immune modulation intervention. So this is something that can actually be cured. It's not uncurable. Some children continue to relapse and require additional testing. Okay, though you might think that your child is completely recovered, they might not. Okay, you might need to still go through to go through further testing. Okay, research following children over the years into adulthood underway to ascertain this evidence. So there is evidence supporting that some children can recover, but also there's evidence supporting that this is not something that the child can recover from straight away, and it could lead further into their adulthood. Okay, now one of the next things that I wanted to find out, ladies and gentlemen, is what happens if PANDAS goes untreated or unnoticed. If a parent or a guardian or someone that looks after a child doesn't notice this was something that the child has, what happens? Okay, and here's what you can find in the internet. Symptoms of PANDAS can leave your child unable to function at school or social gatherings in the future, social situation in the future, okay, into the adulthood. Untreated, symptoms of PANDAS may continue to worsen and can result in permanent cognitive damage. So this is some serious stuff, ladies and gentlemen. If you have a child, okay, I just became a father about 2.5 months ago, so this is something I'm trying to study, and this is something that I believe every parent needs to educate themselves, everyone, because you never know who in your love circle, in your family, or in your friend's family might have a situation like this where it needs to be recognized immediately instead of it being recognized 3 to 5 years down the road. Okay. For some children, PANDAS can become chronic autoimmune condition. This is serious now, guys. It's becoming chronic. Okay, it's becoming a chronic condition if it leaves unnoticed for a period of time. Now, the next thing I want to find out, ladies and gentlemen, is what triggers this disease. What triggers it? What starts it in the first place? And here's what you can find on the internet. Okay, a child might may be diagnosed with PANDAS when they have, once again, OCD. Okay, obsessive compulsive disorder, tick disorder, or both suddenly. Okay, that's one of the things. Now, another thing I wanted to find out is how do some people actually treat this? Okay, how do doctors test for this also? First thing, that's the first thing, not treat it, but how do you actually test for it? Okay, a correct diagnosis of PANS or PANDAS can be made based solely upon behavior. Okay, so they analyze the behavior of a child, okay, the behavioral changes and neurological signs identified, okay, during a careful analysis, looking at the current patterns of a child, historical patterns of a child's behavior, also physical exam by a specialist. So if you believe your child might have any of these symptoms, please, as I'm discussing this, please get in touch with a PANDAS specialist. Okay, I am not a PANDAS specialist, but please get in touch with some. If you can't find some, get in touch with me, and I'll try to connect you with some people in your local area. Okay. Now, one of the questions that I also wanted to find out was, can a child have PANDAS for years? Can they? And here's what I found. With some children, these symptoms last for a few months, some for a few years, and it can actually go as far as few years, and can progressively get worse over time. This is one of the things I did not want to find out, but I found out, ladies and gentlemen, it can get worse over time. While it can be extremely distressing, of course, for a parent or a guardian to witness your child suffer, it doesn't mean that they'll be impacted by this for the rest of their life. So this is something that for a lot of people, for a lot of children, they can actually improve on, but for some, it gets worse. Okay. So yes, there is light at the end of the tunnel, but this is something that you shouldn't take lightly, ladies and gentlemen. The next thing I want to find out, what is the root cause of PANDAS? What really causes it? Okay, and here's where you can find it on the internet. If you really type in Google, what is the root cause of PANDAS, ladies and gentlemen, here's what you'll find. Experts believe PANDAS and PANS happen because of a problem with immune system's response to an infection. So let's say there's a sudden infection. I had an infection, or I don't know what it was called, a flu a few days ago. I was in hospital for it for a few hours, and then after getting blood tests, I just started to leave, right? To just get my result emailed to me. But here is what the root cause of PANDAS is, ladies and gentlemen. A problem with immune system's response to an infection. Instead of attacking the germs, the immune system attacks parts of the brain. And that part of the brain, ladies and gentlemen, is called basal ganglia. So research it, okay? Basal ganglia. What happens when the basal ganglia gets attacked? Here's what happens, ladies and gentlemen. This is the part of the brain that affects feelings, emotions, movements, and other behaviors. So it's a serious part of the brain that gets damaged, that gets attacked when a child, has a problem with their immune system's response to an infection. Now, the next thing I want to find out, ladies and gentlemen, is this recognized in the UK? Does the UK National Health Service recognize this? I was a bit disappointed to find this out, honestly, but PANS and PANDAS are little known and poorly treated in the UK, despite PANDAS being formally recognized by the WHO, World Health Organization. So here we have a situation where the WHO, World Health Organization, recognizes a disease, a problem in the market, yet the UK National Health Service, or the UK national system within the health field, doesn't actually do much to educate themselves about what's happening in this field, which is a bit sad. Now, don't quote me for it. The reference for that is ICD 11 code 8E4A. Okay, just Google that. ICD -11 code 8E4A. Okay, here's where the WHO is speaking about how they recognize this, yet the UK National Health Service does a little job recognizes this, or even studying it further, right? Yet the WHO says 1 in 200 children get affected by this disease, or if not the main disease, by a variant of the disease. Okay, which is pretty shocking. Now, another thing that I wanted to find out, ladies and gentlemen, is how can you know if your child is affected by PANDAS? How can you actually find out? Okay, how can you actually find out? And here's what I found out from the internet. Okay, here was a case study where Mihalik said to meet diagnostics criteria for PANDAS, children must exhibit OCD or food avoidance, along with 2 or more of these neuropsychiatric symptoms. For some kids, it could be anxiety, or for majority of kids, it's actually social separation. Okay, so if you have a child that is separating themselves from their siblings or from family members, avoiding food, showing signs of emotional changes or depression, aggression, behaviors that are not common, then you shouldn't rule out PANDAS. It could possibly be that the child is going through something. Okay, now you might also wonder, and one of the things I wanted to find out also was, what are some of the things that are similar to PANDAS? Okay, what are some of the similar illnesses to PANDAS? Now, PANS is one that is very common. Okay, it's the one that gets closest when it comes to PANDAS, and it actually stands for pediatric acute onset neuropsychiatric syndrome. Okay, this is one of the things that that the UK National Health Service actually analyzes a lot more than PANDAS. So this is the one that comes to the closest to it. Okay, some providers think that PANDAS is a type of PANS. Okay, both are thought to be of those individuals to cause similar symptoms. Okay, so a lot of people, when they have PANS, they also might have similar symptoms of PANDAS. Okay, now the next thing I want to find out is PANDAS disease terminal? And the good news is that it's not. Okay, it's not a terminal condition, but it can get worse. It could affect a child's health and a child's lifestyle quality when they're a lot older. Okay, into their adulthood. Now, what happens if PANDAS goes unnoticed, unrecognized by a parent or a guardian? Ladies and gentlemen, it's quite shocking. Okay, if it goes untreated, here's what I found out from the internet. If it goes untreated, child can develop chronic autoimmune diseases, and OCD symptoms could follow in the future: separation, anxiety, lack of appetite, all the things that you wouldn't want to, on your child. Can you have a mild case of PANDAS? Yes, there have been many cases of mild cases documented of PANDAS, and symptoms look like behavioral problems, isolated tics, sensory issues, and among many issues that require awareness on the part of a parent or a provider. Okay. And if any child has any of these symptoms, by the way, they should be checked by a PANDAS or PANDAS specialist. Now, another thing that I wanted to find out, ladies and gentlemen, is what are some of the symptoms or kind of a checklist. I want to find out a checklist of PANDAS or PANDAS if a child has this, okay? First one is sudden onset of OCD-like symptoms. And then another thing is irritability or aggression, depression or extreme moodiness, poor motor coordination. So if you have a young child at the age of between 3 to 13 that has poor motor conditions, depressions or extreme moodiness, aggression, sensitivity to light, sound or touch, visual hallucinations, sleep disturbance or fatigue, ladies and gentlemen, please get in touch with someone, okay? Now, the next thing I want to find out is how serious is PANDAS? Is this something very serious as they making it look like on the internet, or is it not? By the way, I literally found out about the whole PANDAS about 2 weeks ago when I was at a health wealth seminar, okay? Now, when you Google how serious is PANDAS, here's what you find on the internet. This childhood disorder results from a group A streptococcal bacterial infection, commonly referred to as strep or strep throat, okay? Following infection with strep, children with PANDAS syndrome development severe physical, neurological, and psychological symptoms that interfere with their daily lives, okay? So it is something, it's something to be considered serious when it can affect children, not only on a physical level, but neurological as well as psychological, okay? Now, what is the best treatment for PANDAS? Here's what I found out. It involves 3 prolonged approaches that utilizes psychiatric medications when appropriate to provide symptomatic relief. They also use antimicrobial treatments, but the main thing, ladies and gentlemen, is they provide neuroinflammation, okay, anti-inflammatory to tackle the whole problem. And no wonder why the speaker spoke about this, because I'm in the space of anti-inflammatory omega-3 space, and I try to study as much as I can what are some of the causes of inflammation and how you can tackle it with anti-inflammatory products like omega-3 supplements and polyphenols. And I was quite shocked that this is one of the things that a lot of people don't understand. They don't know about it. I never knew about what PANDAS was, what PANDAS is, and I'm quite shocked to find out how it really goes unnoticed by a lot of parents and guardians, okay? Do PANDAS go away with antibiotics? Some treatments like antibiotics can help or control symptoms of PANDAS, okay? It can help with the OCD, anxiety, depression, and tics part. Other treatments includes, IVIG therapy. Can you test for PANDAS? This is what the internet says. There is no conclusive blood test for PANDAS, which can make it challenging to get diagnosis for your child. So you just have to find out what are some of the symptoms that your child is displaying, and then find out, how many of this is my child displaying, and then go on from there, okay? Hope that makes sense, ladies and gentlemen. I wanted to just spend about 5 to 10 minutes just to make a quick video about my research for the last 1 hour on PANDAS, but just wanted to share with you guys what I came across, what I found out. So please get in touch with a specialist or someone that can help your child if you have found any of the the information that I mentioned to be some of the things that tick with your child, okay? Hope that makes sense, guys. Take care.